You know, myself included, most people, the first time you meet someone, the first thing you notice is their smile. A smile can make such an impression. It starts with the smile, but people that have a beautiful smile, it radiates on the inside too, because their self-confidence level increases and they're able to get on with their day and present themselves in the way that they want. Most of us aren't born with a beautiful smile. Many of us need some professional help. And that's exactly where we are today here on the show. Our guest today is Dr. Becky Coats. Her company is TMJ Plus Wellness Center. Dr. Coats, welcome. Good to see you.
Hi, thanks for having me, Brian.
Well, thank you so much for being here. I mean, you've been practicing dentistry for, you must have started as a child prodigy, all right, looking at you, because seeing the notes today, you've been doing this for over 20 years. Is that correct?
That is correct. Time flies when you're having fun, right?
Well, it absolutely does, but I'll tell you what, you're having so much more than fun for yourself. You're helping other people to have fun because, frankly, there's so many things that a dentist can help us with, not the least of which is pain. From time to time, we experience all sorts of pain because of dental issues, and that's one of the things you're able to help people with. So what are some of the more common things that you work with your patients?
Right. So our practice focuses on keeping people out of pain. And really that starts with not just headaches. So we have a TMJ pain practice. So that's reducing headaches. It's helping people to breathe better, to sleep better. We all know that we're grumpy when we don't get our best sleep. And a lot of that has to do with oxygen. So what we do to help patients is to thrive, to live a pain-free life. And we really emphasize now looking at how people breathe by looking at their tongue and their development. And that might sound like really silly, but it's really key for when our younger generation is growing, that if they have an incorrect tongue thrust or swallow or a tight tongue, it really throws off their posture and their growth, and they start to look different, such as a long face, or their head is tilted, or their kid's shoulders are off, and snoring and even behavior problems. That transcends into the adults that have sleep apnea and headaches.
Well, let's stay on this path here for a little bit, because I would have to think, and you tell me if I'm wrong, but I would have to think that people are surprised when they hear, wait, you're a dentist, you work with tongue issues? That doesn't seem like. Tongue's a big part of the mouth. Why wouldn't you work with that? But particularly with children, that's kind of a passion of yours, isn't it? Helping children from an early age.
Right. Absolutely. It's a passion of mine because of the journey that I went through as a child, through adult, and I want to be able to start where it's easy to help with the little ones when they're growing, developing, so you can help them thrive. Plus, it's easier to have growth and development in a young kid to help out with, not, sucking on your binky or putting your tongue between your front teeth like a tongue thrust. And I really think it's essential because we have our patients, the moms that come in that have all the pain, and they start understanding how they got to the point where they were in their adult life, but yet they're seeing this in their kids where they are snoring or drooling, or they can't really eat a meal effectively. So then it harms their health, because if they don't sleep, then they're grumpy or ADHD, or then the kids have GI digestion problems. So it really begins with this journey that when you help your adult patients, you can start to educate them, and they are noticing what's happening in their children.
Yeah, regarding the education process, there has to be some signs that the child doesn't know, but they're actually giving signs that they're having issues. But in some cases, the parents say, "Oh, isn't that cute the way they tilt their head?" That's a cry for help that people don't know. Are you able to educate parents to say, here's some things you should look for?
Yeah, absolutely. We actually spend a lot of time on our website, which is listed at the bottom of the screen for the users. You can go on there. We've spent a lot of time on educational videos. We have an Instagram and a Facebook page where you can follow along, where you can watch a patient's story, hear their experience, their pain, their emotions, and also how it's affected their family. Matter of fact, we have a video that we posted in our patient life, and it talks about her daughter, that she was just noticing signs that her daughter had, like basically snoring and feeding issues. She sucked her thumb, and then her daughter's posture was off, like where the shoulders were crooked. So I guess I would tell the user at home that if you can see the child, that if their postures are off like this, or their head rotation is off like that, that would be a cry for help. Also, another thing is you can look at how your kid's tongue posture is. basically, if you have your kid open wide and elevate their tongue, if you can see that rubber band, which is called the frenum, or the tongue muscles really tight, and we have a slide about that as well for education, you can start to understand that the development problems that children have was that their tongue was too tight and tethered. It throws off their head and neck, which is why you have young babies who need the helmets where the head was flat. It really stemmed from their tongue that threw off their posture. And then these kids have a lot of narrowing or jaw problems when they go to a traditional orthodontist. But what's really not being educated or taught is that it begins with babies and the kids, and to look at the tongue for an evaluation for that. So that's how we help our practice holistically, is we look at the tongue first to be able to know how to help our kids grow and thrive, which really, bottom line to that is, the tongue is so important for breathing, speech, but it also is why people have crowded teeth and they have snoring and breathing problems. So again, bottom line is you need to check the tongue first before you do anything else dental-wise.
So Dr. Coats, back 20 years ago when you began your practice, or even before that, when you were in school learning to do what you can do now, was this something, or is this something that you learned later on after you began your practice through continuing education?
Definitely not taught in dental school. You know, I graduated 20 years ago, so we have so much more education than what we do now. But really, it's that I think where you learn all this is that if you have the issue yourself, you're going to want to research and learn how to fix yourself or to help your kids, and that's what happened with me. So I have had to do countless hours of education and travel all over the country to learn from, you know, breathing coaches and other physicians such as ear, nose, and throat doctors who understand this. I've even gone so far to understand bone biology and travel all the way across to the East Coast to understand how does the development of the face work. And really, if you can understand that, you can understand then how to unravel these problems that then can lead to serious health effects.
You know, it's always so impressive to me to find out that we have issues and we think they're being caused because of this, and you're not even close. So someone like you to come along to bring this stuff up, if you have parents that maybe they have got to the point to where they've noticed issues in the children and they've been going other directions to try to repair it, are they just so relieved when they get with you and say, this works, where have you been?
Absolutely. I think that that's the more rewarding thing that I have seen in my career, and that's where it hits home to my heart, is that that's my life's passion. When you educate and you can help someone, you can't really put words into that. It's basically you're helping someone not just with their pain, but you're helping them so then they can help their friends or family or neighbors, and then to go that way. So that's a common thing that's very humbling to hear from our patients of, I wish I would have met you sooner. And we hear that often, and my team tells me, hey, Dr. Coats, did you hear this? You need to really appreciate that, because, you know, when you have someone crying in your office, it's not the typical what you would think in the dental office because of pain. It's more of that sigh of relief, and you know that you can help me. So that's what I'm just very blessed and grateful for.
Well, and I have to think that if there's people crying, a lot of times they're crying happy tears because of where you've been able to get them, that they had no idea they were going to be able to do that. Well, last but not least, minor detail here, where are you located? Where do you practice?
I'm in Grapevine, Texas, and right where Grapevine and South Lake come together, and we're right by DFW Airport. And a great central location between Dallas and Fort Worth.
Well, Dr. Coats, thank you. And again, everybody want to make sure you picked on what she said earlier. Check out the website, because you've heard what the doctor has to say. Why not hear what the patients have to say? That might be even more interesting to you. Dr. Coats, thank you to you for everything you do, and thank you for taking time out of your busy practice to be with us today. I appreciate it. Keep doing what you're doing, putting smiles on people when they thought they couldn't get there. Take care.
Thank you.